All right. Good evening, everyone. So sorry that we are running quite a few minutes behind schedule tonight. You know, technical difficulties, it happens, but we're here and we're excited to be here. For those of you that don't know me, my name is Signy Espinosa. I use she, her pronouns, and I'm the interim executive director at Planned Parenthood Pennsylvania Advocates. I'm really excited about tonight's event, although I wish we were hosting this event under better circumstances. For those of you that don't know, last month, State Representative Kathy Rapp kicked off a series of anti-abortion House health hearings in our legislature. And yesterday was the fourth hearing, totaling 13 and a half hours of anti-abortion rhetoric, misinformation, lies, and harm, all on taxpayer dollars. That's why we're here tonight. And for those of you that don't know or aren't aware, Planned Parenthood Pennsylvania Advocates is just one part of the Planned Parenthood network footprint and community. There are 3 incredible Planned Parenthood affiliates throughout our state that have health centers serving thousands and thousands of patients each year. And so we're bringing those voices together tonight. We're bringing our statewide Planned Parenthood voices to demonstrate solidarity as we continue to navigate attacks on safe legal abortion in our state. Tonight, our goal is really just to create a space to center facts, evidence-based practices, and have a stigma-free conversation about abortion and the fights ahead. I'm going to turn it over to our fabulous CEOs who are here tonight to introduce themselves. Kim, Dale, and Melissa, please share with folks your name, your pronoun, and your pronouns and your affiliate.
I'll start. I'm Kim Everett. I'm CEO of Planned Parenthood of Western Pennsylvania, and my pronouns are she, her.
Okay, I'll jump in. I'm Dale Steinberg, President and CEO of Planned Parenthood Southeastern Pennsylvania, serving 4 counties in Southeastern PA, and my pronouns are she, her.
Good evening. My name's Melissa Reed. I'm the president and CEO of Planned Parenthood Keystone. My pronouns are she, her, and Keystone provides services in 37 Pennsylvania counties in eastern and central Pennsylvania.
Thank you all for introducing yourselves. Now, before we get started, I just wanted to name that there's many things I can't wrap my head around after these hearings, but one of them is definitely the fact that we haven't seen patient voices centered in discussions. Representative Frankel alluded to this at yesterday's hearing, and he expressed his frustration, and I think we all know why Kathy Rapp does not want to include these voices, and it's because they're powerful. And the truth is that there are people who have access to abortion care in her district, in Stephanie Borowitz's district, and Representative Kate Klunk's district, in all of the anti-districts. And so I think we can all agree that these anti-legislators do not have the best interests of their constituents. Otherwise, they wouldn't be having these hearings, and they would definitely be open to having patient voices. So tonight we have a very special guest who is going to be sharing her story and sharing a poem. Her name is Abby Miner. She is a patient storyteller. She sits on the board of the Abortion Conversations Project and has been widely recognized for her advocacy and storytelling around accessing abortion care. Abby also lives in Representative Stephanie Borowitz's district. So for those who don't know who Stephanie Borowitz is, she's actually the primary sponsor of the 6-week abortion ban and has led efforts recently in our state to ban trans people from sports. Abby, welcome. I'm so sorry that she is your legislator. I'm so excited that you're here tonight. Tell us a little bit about yourself, and we're so excited to hear your poem.
Thank you so much, Signy, and thanks to all of you so much for the work that you do. I also am very unhappy that Representative Borowitz is my representative, but at this moment we can't do anything about that, but I hope to during the next election. So I live in a very rural part of Center County. I accessed abortion care in 2013. I was in my late 20s. I was in grad school. I was living with my partner, who's still my partner, And it was a strange experience for me because it actually would have been a fine time to have a kid, but it was kind of the first moment of realizing that I don't have a strong desire to have children. So that was really eye-opening for me just in and of itself, to like deal with my own realizations about, you know, what my own life might look like. But on top of that, it was an incredibly eye-opening experience in terms of the state of abortion care. I think, like a lot of folks, until you try to access care, you maybe don't know what things are really like. I'm the daughter and the granddaughter of women who've had abortions, and so I sort of thought like, well, things are better now. But in fact, I often say, I think it was easier for my grandmother to access abortion in New York City in the 1940s. You know, before Roe v. Wade, than it was for me in the 21st century in rural Pennsylvania. So that was really eye-opening, and it was eye-opening in terms of reproductive politics more broadly. It was also eye-opening for me in terms of what counts as a good abortion story or an acceptable abortion story. I've often felt anxiety around telling my story, and I think that's partly because I don't feel like I have a lot of good reasons in the way that sometimes we think about that. You know, I was financially okay, I was living with my beloved partner, and I just really didn't want to be pregnant. But the truth is that it was really, really life-changing for me to access abortion care, personally, and I think also politically. And so I've thought a lot over the years about how much we ask pregnant people to defend the desire not to be pregnant, whether we have that desire once or forever. And like Stigma said, I've gotten involved in a lot of projects that support different kinds of abortion storytelling, mostly through the nonprofit Abortion Conversation projects, which I'm on the board of. So this poem that I want to read for you, I wrote last summer, and it deals a little bit with that ambivalence about abortion storytelling and some of the difficulties of talking about abortion, whether in legal terms or poetic terms. So I wrote this right after the Supreme Court's ruling on June Medical Services v. Russo. And even though that felt really, you know, I think a lot of us know, it feels really great when we get a ruling like that, but we also still wish so many things were different. This poem is called Poppies. There are poppies in bloom all over the yard. All night they fluttered blackly their trim dresses, which are also their bodies. All night my eye sockets filled with the pebbles of insomnia, while the hours moved around me like old cars. I was trying to give myself as in marriage to a country that wouldn't have me, wrapped in a white sheet to the country of dark air. Now the sun swishes its greasy windshield wiper. The poppies glow dead red. I have to tell you, sometimes I hate poetry for all it refuses to say. Sometimes I hate the law for all it sits there picking the alphabet out of its big teeth. What I wish the court had said, we should not be forced to translate leaves of blood, nor to live by translations hacked out by those who scarcely speak the language. So speak the language, can you? Maybe I am an animal within an animal. I feel the stone beneath my breastbone the size of a woman's shoe. Thank you all so much. And yeah, I send great gratitude for the work that you do.
Thank you so much, Abby. What a beautiful poem. You can see us all smiling here. You kind of gave me the chills there. I hope you continue writing and you continue doing the work that you do. And your story is so beautiful and important.
Thanks, Sydney.
Thank you. Well, Abby's definitely grounding us in for this conversation tonight. And I know tonight we've got a packed agenda and not a lot of time. So for tonight's first part of the discussion, we're going to focus on facts. I know that the hearings have not been focusing on that unless it's Melissa Reed up there spitting facts or or some of the other speakers that have been there. So we're going to talk a little bit about the reality of accessing abortion care in Pennsylvania. And my first question is for you, Kim, really focus on the local consequences of trap laws in our state. Pennsylvania is down to 17 abortion providers. Can you talk a little bit about the history about how Pennsylvania went from having 140 plus abortion providers in the 70s down to 17 now?
Yes, I can speak to some of the factors that may have impacted the number of abortion providers. I don't know if I can account for all of them, but I can talk about what we've seen in Pennsylvania that I believe has had a major impact on abortion access. Anti-abortion politicians have used a wide array of legislation to restrict access and to put obstacles in the way of patients to keep them from receiving abortion care and to make it more difficult for providers to deliver that care. The laws that are passed specifically targeting abortion providers are called TRAP laws, which stands for Targeted Restrictions on Abortion Clinics. TRAP laws are enacted under the guise of patient safety, but in reality, they're costly and unnecessary, and they are designed with the overall goal of creating additional burdens for providers and forcing clinics to close. And they make it very difficult to open new clinics. With almost all of the abortion laws passed, including TRAP laws, we know that they have nothing to do with safety and everything to do with dismantling abortion care. So in 1982, which isn't far off from your 1970 date, Pennsylvania legislators passed the Abortion Control Act, which created enormous barriers for patients and burdens for providers. Among other provisions, this law requires that you have parental consent for minors, a 24-hour waiting period on people seeking abortions, and a mandatory lecture by a physician. This law created new and challenging barriers for people seeking abortion. It also, though, placed a lot of burdens and significant costs on the provider to implement these regulations. This strategy to make abortion inaccessible has not only continued, but it's increased. Between January 1, 2011 and January 1, 2019, states have enacted 483 new abortion restrictions, accounting for nearly 40% of all abortion restrictions enacted in the states since Roe v. Wade was decided. And during the same time period, another very difficult restriction was passed in Pennsylvania. In December 2011, Pennsylvania legislators passed a TRAP law, which was ASF regulations for abortion providers. This law mandates that any entity providing abortion services in the state has to be licensed or accredited and follow very specific Department of Health regulations. As a result, abortion providers had to adopt new policies and procedures in many areas, including staffing and governance, training, and facility maintenance. We had to renovate our abortion centers to be in compliance with ASF facility standards that were being enforced. And our Pennsylvania affiliates in Western Pennsylvania, our Pennsylvania affiliate had to spend $350,000 for facility renovation to redesign the clinic layout and replace ceiling towels, flooring, sinks, light fixtures, part of our HVAC system, and many other pieces of our physical space. It took us 1 year to come into compliance and receive our license. Not all providers, though, became ASF facilities. Some of the freestanding clinics closed. And in addition, a lot of physicians provided abortions in their offices prior to this regulation. But once this regulation came into effect, that really wasn't possible in a typical office setup. So we lost many providers that way as well. So these TRAP laws do serve their intended purpose in that regard. Clinics have closed, and it's definitely more expensive to operate now with these regulations. I should also note that Pennsylvania is not unique with our TRAP laws. More than half of the states have laws that institute onerous and irrelevant licensing requirements and set standards that are just extremely difficult for abortion providers to meet. Right now, there are currently 2 TRAP laws being considered in the Pennsylvania House and Senate. The Fetal Remains Bill, which I believe Dale might be talking more about and discussing, and the Clinic Reporting Bill, which seeks to force abortion clinics to share information that is already available to the public. It just makes additional burdens and hurdles for abortion providers. So I guess the only other thing I will add is that there's a lot of research showing that outpatient abortion care is very safe, but still legislators persist because it's not really about safety. Unfortunately, it's about creating barriers. It's about driving abortion providers out of business. And this is an unfortunate trend and something that we've got to continue to fight against. Thank you.
Absolutely. Thanks, Kim. I know that, just listening to you, another consequence of TRAP laws in our state is that we're living in times where it's easier to access a crisis pregnancy center or a FAKE clinic than it is a real healthcare provider or a Planned Parenthood health center. And so during the recent hearings, there was a lot of discussion focused on abortion reversal. And these so-called procedures are not real, they're unproven, they're unethical. So my question is for you, Dale. Can you talk a little bit more about abortion reversal rhetoric, how anti-abortion groups like Real Alternatives and other crisis pregnancy centers promote abortion reversal and push this dangerous, shaming and stigmatizing anti-abortion view on Pennsylvanians?
Yeah, sure, Signe, thanks. Okay, to start, there generally, in general, two methods of abortion provision. One would be surgical abortion. The other is medication. This so-called abortion reversal refers to medication abortion. And let me just say that medication abortion is safe and effective, and it ends a pregnancy through a combination of two prescription drugs. The first is mifepristone, and the other is misoprostol. And the American College of Obstetricians and Gynecologists describes this so-called abortion reversal procedure as unproven and unethical. That's just for starters. And ACOG and the American Medical Association agree that there's no scientific or medical evidence that medication abortions can be reversed, even through a course of treatment. There's no credible evidence that what those who are promoting this abortion reversal advocate. They advocate that taking progesterone to continue the pregnancy instead of taking that second drug, misoprostol, to end it is any more effective than foregoing the misoprostol altogether. But yet not taking the misoprostol may actually increase the risk of serious adverse events. So there are no objective or credible data because there have been no clinical trials. And abortion reversal has not been tested for safety, efficacy, or side effects. These proponents of abortion reversal cite the frequency of something they term abortion regret. All right, abortion regret. There's no source material that supports this claim. And at least 95% of those who have abortions say that they made the right decision. The most common feeling, and I've been saying this for as many years that I've worked in abortion provision, the most common feeling that people have after an abortion that they report is relief. People deserve and are entitled to accurate information, and we trust our patients to make the right decisions about their bodies, their families, of course, and their lives and their futures. Anti-abortion groups and legislators push dangerous lies about abortion reversal procedures to shame and stigmatize the patients and also, obviously, the physician providers, and to intrude, as they tend to do, on personal decision-making. They also attempt to introduce legislation that would legitimize abortion reversal as an option that would be required during an informed consent process prior to the procedure. Measures like these are written by politicians, not physicians, and are about shaming women and blocking access to safe, legal medical procedures. These elected officials and special interest groups behind these bills, like this particular bill, are the same groups that are working to end access to abortion in Pennsylvania. Patients don't turn to politicians ever for advice about mammograms, prenatal care, or cancer treatment, and politicians should not be involved in a patient's personal medical decisions about their pregnancies. You also asked me to touch on crisis pregnancy centers, did you? Yes, I shall do that. Okay, shorthand for crisis pregnancy centers is CPC. So CPCs are fake health clinics run by anti-abortion organizations that claim to help pregnant people, but instead they attempt to coerce and deceive and manipulate them into carrying their pregnancies to term. CPCs are known to have provided patients with biased and inaccurate information, including abortion reversal, and they purposely misled patients into thinking they are obtaining health care. CPCs are widely considered to be unethical by healthcare professionals and by the American Medical Association. And CPCs, rather than offering unbiased information on the risks of both pregnancy and abortion methods, they often provide inaccurate info and materials that rely on completely debunked studies that misrepresent the safety of abortion. Crisis pregnancy centers in Pennsylvania, by the way, they far outnumber abortion centers. They use taxpayer money to push their political agenda. And many of these unprincipled institutions receive dollars from the Pennsylvania budget. So the General Assembly of Pennsylvania funds the Real Alternatives Program, which is an umbrella organization that funds hundreds of CPCs in the state. And they receive more than $7.2 million annually. In 2020, Pennsylvania spent more than twice as much on CPCs than on actual sexual and reproductive health care. And in Pennsylvania, Real Alternatives received more than $30 million in a grant from the Department of Human Services over a 5-year period ending in 2017. The Auditor General performed an audit after a DHS audit showed that the organization was deducting a 3% fee from state reimbursement to its subcontracted service providers. Real Alternatives refused to cooperate with the audit, believe it or not. They refused to disclose where the fee money was going, and they actually sued the Department of the Auditor General and DHS to block access to records to show how this money was spent. And the audit eventually revealed that Real Alternatives was misusing the fees amounting to nearly $500,000 in taxpayer money to fund its activities in other states. Yet Pennsylvania CPCs to continue to expand their support for abortion reversal. And a recent review shows that 40% of Pennsylvania CPCs promote this unethical abortion pill reversal. So it's dangerous, it's misleading to pregnant people who seek care at these fake health centers. And it's further evidence that Pennsylvania really needs to cease and desist pushing and funding this entire political agenda.
Whew. Yeah, our state is quite literally perpetuating violence on communities. And unfortunately, it's often communities of color, youth, LGBTQ plus folks that often bear the brunt of that and already experience barriers to care. I want to go back to what you said around abortion regret and how that's definitely not a thing. You said that folks often feel relief. I know when I access abortion care years ago, I definitely felt relief. And I think one of the things that was difficult was the stigma behind it. And it's exactly what we're seeing in these hearings. I want to go back to that because we saw a lot of the stigmatizing language in the hearings around abortion care, around patients who access abortion care, and around providers who provide the care. So Melissa, can you talk a little bit about the impact that stigma has on patients accessing care and why it's so important for us to be unapologetic about abortion access?
Yeah, Stigma, I'm happy to. And, you know, it really helped clarify hearing Abby speak about her personal feelings with stigma and how certain she was that this was the right decision for her, and yet still outside voices really continued to stigmatize her decision. Abortion stigma creates environments where anti-abortion legislation can gain oxygen and airtime, like we saw with those hearings. During one of the hearings, a lawmaker used highly inflammatory and non-medically accurate language to describe abortion. In fact, I can't remember, was it Representative Owlett who was doing that? Yes. Yeah. And that kind of blatant ignorance is so harmful to patients and perpetuates harmful ideas about abortion. Because abortion is healthcare, and ensuring access to abortion care is vital to ensuring the health and well-being of our communities. You mentioned health inequities and disadvantaged communities being impacted the most by these decisions. And our state is facing a rise in maternal mortality, especially among Black women, and limiting access to abortion increases those risks. Patients are the authority on their own lives, and as healthcare providers, we are there to provide them the information necessary to make the best and most informed decisions they can for their future. And something else that really frustrated me was that lawmakers during the hearings have used gendered language. And we know that pregnant people don't fall within the binary. And by refusing to acknowledge the multi-layered identities of people who get abortions, we are further perpetuating that stigma, that sense of shame for people who need us to be there for them no matter what. All three of Planned Parenthood Pennsylvania affiliates proudly offer abortion care.
Yeah, and I'm glad that you do. I know when I was a patient, I was like, I don't know where to go. Oh, Planned Parenthood. So y'all are oftentimes also, in addition to sexual and reproductive health care, the first entry point of care as well for a lot of people. I know some of your health centers provide flu shots and have mental health services. And so we are a critical part of the safety net and of the healthcare provider network in Pennsylvania and across our country. One of the things I keep thinking about is, in addition to these hearings, this committee is going to run these bills. And so I do want to shift gears a little bit to talk about the bills that we're anticipating that are going to run and that they're going to fail. So also a waste of time because they're going to fail, and they have failed before. And we know that Governor Wolf is a champion, and he will veto these bills. Any bill that would restrict access to safe legal abortion, we have his commitment that he would veto that bill. So my first question is for you, Kim. House Bill 904 would ban abortion at 6 weeks. This is right before most folks even know that they're pregnant. Can you talk a little bit about the dangers of this bill and why we refer to it particularly as a 6-week ban, and why we tell legislators, please, it's a ban on abortion, and why the opposition really likes to refer to it as a heartbeat bill. Can you talk a little bit about that?
Yes, thank you, Signe. Well, to begin with, the use of the term heartbeat bill is inaccurate. It's medically inaccurate language and is used by the anti-abortion movement and by politicians to spread misinformation and drive a false narrative. Terms like this evoke false images for people in their minds so that they view abortion, which is common and accepted health care, as Melissa was saying, but they now view it as immoral or shameful. And they use this language to divert attention away from the fact that they are banning abortion early in pregnancy and that they are hurting people. Like most of the bills that we've discussed already, or we're going to discuss tonight, this bill is dangerous and it takes away access to abortion care. This bill would essentially ban most abortion in our state, even in cases of rape and incest, or when a person's health or life is at risk. A 6-week abortion ban is so early in pregnancy. Most people don't even know they're pregnant, or they're just finding out that they're pregnant. And often it's like 2 weeks past a missed period. Legislation like this is so harmful, and it disproportionately impacts marginalized groups, people in rural areas who don't have good access to health care, people who don't have insurance or financial means to easily obtain care. Essentially, this bill takes away the person's right to make their own medical decisions before they even know they have a decision to make or they're able to act on their decision. And as we were saying previously, important decisions should be made by individuals in consultation with their doctors and their families, not extremist politicians. And in this case, the extremist politicians are making people's decisions for them. If this law would go in effect, people would be deprived of their constitutional right affirmed in Roe v. Wade. It will leave people facing heartbreaking and potentially life-threatening consequences from losing access to safe legal abortion.
Yeah, and there are quite a few of these anti-abortion bills that these anti-legislators are proposing, and they're all intended to do just that, to ban abortion entirely. And I think, oftentimes folk will ask, which one's worse? And I always just say they're all terrible, right? Not one bill is worse than the other, and they're all intended to decimate access to abortion care and chip away at care little by little. So my second question is for you, Dale. Anti-abortion legislators argue that the so-called fetal remains bill, I know that one is tricky for some, gives people options. We know that is not the case at all. We know in reality, this is another way to be a little sneaky and to shame and stigmatize patients who've already decided that they want to have an abortion. It, restricts clinics and forces additional costs onto patients. We know this, but can you talk a little bit more about the harmful effects of the fetal remains bill? That's House Bill 118. And what would this look like in practice for patients, for providers, and for our health centers?
Sure. I just want to backtrack to what you said, Stigma, earlier about, they're destined to fail because they'll be vetoed, which really underscores their intent. I mean, they know they're going to fail, but if they raise them, we can discuss the myriad reasons that they do that, but not for tonight. This particular fetal remains bill would actually require that anyone having an abortion would have their embryonic or their fetal tissue either buried or cremated. So essentially, imposing a funeral ritual after an abortion. So the bill mandates that hospitals or clinics arrange for ritual disposal of all medical tissue from a miscarriage, an ectopic pregnancy, or an abortion, no matter how early in the pregnancy, and requires a death certificate be issued for all medical tissue. It actually also changes the definition of fetal death to include products of conception. It also creates a public record which violates patient privacy and compromises their safety. And a healthcare facility that would violate this act would be fined. And anyone charged with not fulfilling the duties outlined in the act may be imprisoned in a county jail for up to 30 days. Healthcare facilities that provide abortion currently follow laws that govern safe tissue disposal. We've been doing that years on end. This legislation would change that without any health or safety justifications at all. Elected officials really shouldn't be forcing stigmatizing requirements on patients and their healthcare providers. And this restriction is clearly intended, as we keep saying, to shame people who have already made the personal decision to have an abortion. We need to respect everyone's ability to make these deeply personal decisions to have abortions. By targeting centers that provide abortion, this bill would threaten access across the state. As you might imagine, in some communities, funeral homes or cremation facilities may simply refuse to work with healthcare centers that provide abortion. And nothing in this bill would prevent them from doing that. Ultimately, if abortion providers are unable to obtain any sort of contracts with funeral homes or cremation facilities, those providers would be forced to close. So you can just imagine, what that would do to access in the state. And as I mentioned, in addition to access, this bill seriously threatens patients' privacy and confidentiality. Pennsylvania law requires the issuance of a death certificate already prior to cremation. Okay, but this, in general, I'm not talking about fetal, And this bill could require funeral directors to collect the same documentations for tissue resulting from an abortion, regardless of a person's wishes or how early in the pregnancy. So this is just another abortion restriction in the long line of abortion restrictions, part of the anti-sexual and reproductive health legislation pipeline, if you will, that are operating not just in Pennsylvania, but across the country. And that, it ignores input from the medical community and additionally from constituents and patients. And so let's be clear, this bill is part of a larger coordinated effort of anti-abortion activists to seek to legalize abortion, period.
Yeah, and I've gotten folks ask me, can you put it in perspective, right? Like how would that really impact access? And I'm like, well, when I had an abortion, I wouldn't want public record of that. So then where would I go? Right? Like that would mean I'd have to travel to another state, and that costs money. And in practice, it's literally just in a way to deter people from having an abortion. And it's really gross. And so unfortunate. And I think folks oftentimes struggle with that bill a little bit, but it's just as bad as the others. So I know we've got one more question, last question, as far the bill's conversation goes. We know that this question's for you, Melissa. The House Health Committee also dedicated an entire hearing on the Down syndrome abortion ban. This bill would literally ban abortion after a prenatal diagnosis of Down syndrome. We know that no statewide disability rights groups has supported this bill or endorsed it in any way, shape, or form. Can you talk a little bit about the connections between ableism and reproductive oppression, and what it would actually look like if the legislature supported people with disabilities? Because I think, that's something that this bill doesn't do. So can you talk a little bit about that?
Sure. So there is a definite link between ableism and reproductive oppression, and it is an issue of reproductive justice. I had a great conversation with Representative Benham about this a couple weeks ago, and she is the first legislator in Pennsylvania who's open about having a disability. And she mentioned, and this is true, that those within the disability community routinely face this paternalism and pushback in determining their reproductive health decisions, including whether or not to get pregnant. Some individuals cannot get or stay pregnant due to health conditions that would put their lives at risk. And those who do wish to get pregnant often can't due to lack of access to affirming care and to doctors who will help support them through that journey, or from economic constraints that would support them during their, during their pregnancy and parenting. What would be better is, as you said, to support people with disabilities and not decide for them what's best for them. The Pennsylvania legislature should pass bills that expand the social safety net for those people who parent folks with disabilities, and for those who have disabilities who choose to parent. This could include Medicaid funds for home health aid, greater access to healthcare, educational supports, and so much more.
Yeah, absolutely. I tuned into that event, and we're so lucky to have Representative Benham in the legislature and on the health committee. I think it's really important to have her there, and she's fantastic. So we're super fortunate for her leadership. I think we can all agree we're dreaming of better days when Representative Kathy Rapp is not the chairwoman of this committee and our legislature looks differently. And hopefully one day we can actually work to pass legislation that actually supports sexual and reproductive health care in our communities. We've all relied on Planned Parenthood at some point in our lives, and they provide amazing health care. I don't know where I'd be without it. So I definitely want to make space for that tonight. I'm going to transition us into our last topic of before we get into the Q&A section that will focus on patient assurance. I think it's super important for us to uplift the amazing healthcare that the health centers provide and have provided. So my first question is for you, Kim. You know, we're still navigating the COVID-19 pandemic, and, you know, while anti-abortion legislators stopped at nothing to use this opportunity to exploit the pandemic and push a blitz of bills and have these hearings, you know, Planned Parenthood has done more to safeguard patients and continuing to provide care during the pandemic. Can you speak a little bit about what Planned Parenthood Western Pennsylvania has done to keep patients safe and to also keep comprehensive sexual and reproductive health care accessible and affordable during the pandemic?
Yes. Well, I have to say, like so many people, businesses, and organizations, the pandemic has been hard for Planned Parenthood. When it first hit, like everyone, we had to figure out how to keep our staff and patients safe, and at the same time, ensure that patients had access to the essential services that they need. But you are right, though, Signy, that unlike politicians, we were concerned about our patients' health and well-being, and we worked very hard to make sure they still had access to services. We are very fortunate in Pennsylvania to have a wonderful partner who works with us, the Women's Law Project, who was really critical and an effective bridge for us to the Department of Health and the governor's office at this time. So last spring, when we had the shutdown in Pennsylvania, the Women's Law Project kind of led the charge to get agreement that abortion care is an essential service, which allowed us to remain open and to provide this essential care throughout the shutdown and, you know, ongoing through this pandemic. I think that this has helped raise awareness in the community too of what an essential service is, and it's highlighted the important role that Planned Parenthood and other abortion providers have in making reproductive health care and education available to people in need. To continue to serve our patients, though, while all this is going on and keep our centers open, we did closely follow CDC guidelines, which included routine sanitizing of high-touch areas, limiting the traffic in our centers, conducting COVID screenings and temperature checks of everybody coming into the center, and of course, requiring face masks of everybody, patients, staff, etc. All of the Planned Parenthoods, I think, also looked very closely at how we could continue to deliver our family planning services to people. And very quickly, we transitioned to telehealth services. At our affiliate, by April 2020, we were providing telehealth by phone and video to people in their homes or whatever their preferred space was as a safe and effective service delivery mode. We couldn't do all services this way, but we were able to offer routine STD screenings, birth control appointments and refills, PrEP visits, and emergency contraception. We also moved our behavioral health program to telehealth, which has been really critical for people during the pandemic. More recently, we added hormone therapy for trans people, which we also make available in person and by telehealth. We did still, as I mentioned, continue to do abortion in person and some other services that have to be delivered in the clinic. And of course, as things have improved, we've been able to move things more to the clinic, and we're going still between telehealth and clinic services, but hoping to move back to a more regular routine. In addition to our usual services, though, I think our staff was really creative in trying to really meet people's needs. A couple programs and special efforts that they got underway was a campaign to encourage people to get their contraception by mail so that people would not be without what they needed. They created a list of community resources to assist people with additional needs. They initiated what we called a grab and go program to provide free emergency contraception and other safe sex supplies to those in need. And more recently, our health center staff has established mini food pantries at several of our health centers after learning that many of our patients have food insecurities. And although we are not actually providing the COVID vaccine directly, we have arranged with Rite Aid to do 2 vaccine clinics at our Pittsburgh office this month because we recognize that a lot of our patients had not been vaccinated, and we want to be able to get that vaccine to them as easily as possible. And if this is successful, we believe that we'll be able to do more with Rite Aid. So that's been an exciting new opportunity for us. And the last I wanted to mention was our education staff, who worked really hard during the pandemic. It's been very difficult for them, particularly because they mostly work with youth in person. So immediately after the pandemic hit, they connected with peer educators and other youth through video and have been able to do a few socially distanced activities. More recently, we set up a special internship program to keep youth engaged that we plan to run at least through the fall, when we hope to be back in person with them again. And our educators are also supporting youth through regular teaching at health classes in a number of our Pittsburgh City schools. So we've done a lot of things very quickly, I think, to try to adapt to the changing environment, keeping focus on what our patients' needs are and how we can best help them during this time. We do hope to transition back to a more normal time very soon and get things back to normal, but I think it has challenged us to be creative, and I think we found some new and important ways to engage with patients and to support them that will continue past the pandemic.
Wow, that's so exciting about Rite Aid. I mean, congratulations, that's huge. Reminder for folks tuning in, make sure you get your vaccine. I know I got mine. I got Johnson & Johnson, limited time only. So I wanted to go back, Kim, earlier you said, you know, sexual and reproductive health care is essential. It is, so is abortion care. And so are telemedicine, so is telemedicine and telehealth services. So I'm gonna pop a question over to you, Melissa. I think I'm excited to talk to you about this because you actually testified at one of the hearings and talked a little bit about this. And I always just want to bring it back to this because there's a lot of conversation and a lot of confusion around telemedicine abortion. And during the hearings, we saw that. Can you walk us through how telemedicine abortion works? I think you for sure have this down at our various health centers, and the recent changes to the REMS rulings and what that means for us and what that has enabled us to do as well.
Absolutely, and you're right. There was so much confusion at the hearings around telemedicine abortion care and how it worked. And let me just say, full stop, that the ability to deliver medical abortion through telehealth is allowing us to reach patients who need this type of care throughout rural Pennsylvania. And that is a really, really great service that I'm excited about. So before the recent changes to the REMS restrictions on this type of medication, patients had to come into a health center to receive medication abortion, even during telemedicine visits that were just site to site. So our health center in York to our health center in Wilkes-Barre. And patients would be with a medical center assistant in one center, and then our abortion provider would be at another location. Through a direct, secure video conferencing software, they would have a discussion about the abortion and make sure that the patient understood all that was going to be happening with the medication abortion. And then the clinician would provide the medication in our center where the patient was in full view of the doctor. And this was approved by the Pennsylvania Department of Health. And we've been offering this service since 2019, offering it site to site. The recent changes to the REMS ruling has eliminated the need for the patient to come into a center and receive the medications used for medication abortion. The FDA now allows mifepristone to be delivered to a patient through the mail, either by or under the supervision of a certified prescriber or through a mail order pharmacy when such dispensing is done. under the supervision of a certified prescriber for the duration of the public health emergency, which we're currently under. So this means that patients may not ever have to leave their home to get abortion care, because telemedicine abortion and the REMS changes means they can access care from the safety and convenience of their home. And so we are really hoping to launch this service and make abortion care even more accessible in the very near future.
I'm looking forward to that day. Super exciting. And thank you for explaining that so eloquently. I think folks definitely struggled. And I think it's quite simple. So thank you for that. And I've got one last question for this portion before we start getting into the Q&A section of tonight's program. I think we wouldn't be Planned Parenthood if we didn't talk about next steps and proactive policies that actually improve the lives of Pennsylvanians. So my last question is for you, Dale. After hearing about the bills and the various attacks on abortion that we continue to see, it's obvious that we have some big fights ahead, but we also have some opportunities for some proactive bills to expand access and to continue the conversations and laying the groundwork for, if we can't do it this year, maybe in the next. Can you discuss some things that you would like to see accomplished this legislative session, and how, you know, maybe a bill or a policy or some kind of change would positively impact the patients your health centers serve?
Sure, Sydney. Yeah, thanks. Planned Parenthood, as we all know, spends an inordinate amount of time on the defense and spends, you know, inordinate resources, both, you know, monetary and people, you know, fighting bad legislation to talk. And so it's really, I'm genuinely happy to talk about some positive legislation. We don't get the opportunity to do that very often. So yeah, a few proactive bills that I'll point out. One is Representative Morgan Cephas has introduced a maternal and child health package, which would address the unacceptable maternal mortality rate in Pennsylvania and the dangers that people giving birth face. It would also address the public health crisis of racism, and that due to systemic racism, particularly in sexual and reproductive health, Black people are at much higher risk when giving birth and also postpartum. Included in the package are 3 bills. One is Medicaid expansion for postpartum care, critically important. Also fighting maternal morbidity and mortality, and addressing maternal mortality and Medicaid coverage for doulas. Last year, the Supreme Court of the United States ruled that employers are able to be exempt from the Affordable Care Act mandates based on the religious or moral values, I put moral in quotes, to provide birth control to their employees. This ruling endangers the health and economic security of 2.5 million people in Pennsylvania who depend on this coverage for access to affordable and effective contraception. Contraceptive access legislation like that introduced by Representative Leanne Kruger last August would expand access for millions of Pennsylvanians. And we all know that all people deserve comprehensive sex education that is identity inclusive and provides the tools and resources to form healthy relationships, and also to understand and practice consent and giving consent and setting healthy boundaries and basically taking care of their sexual and reproductive health. A means of ensuring young people get the education they want, need, and deserve would be passing a comprehensive sex education bill that, like the one that's about to be introduced in the House by Representatives Jessica Benham, who's been mentioned earlier, and also by Representative Brian Sims. We've spoken at length tonight about the ways in which anti-abortion politicians are attempting to roll back access to abortion. Representative Christine Howard wants to protect the legal right to abortion by introducing legislation to codify Roe's protections and codify that into Pennsylvania law. Lastly, there is expedited partner therapy, which is an important tool to limit the spread of some sexually transmitted infections. And its use is supported by health and medical organizations. And it's the CDC recommended best practice for treating the sexual partners of patients who are diagnosed with sexually transmitted infections. An expedited partner therapy bill, Senate Bill 317, passed through the Senate and was referred to the House. While we know that passing legislation doesn't automatically translate to access for all, we know that these bills serve as examples of the ways we can be thinking about putting patients first, putting families first, and putting communities first by prioritizing healthcare, especially during a pandemic, and working in good faith with our elected officials to protect and expand access to sexual and reproductive health care and rights.
Yeah, absolutely. I think we say this all the time within our spaces that we're living multiple pandemics within a pandemic, and oftentimes we've got some simple solutions like these bills, and hopefully we can get some of these bills passed because lives literally depend on it. Dreaming of better days, as always. Now I want to shift gears, thank you, Dale, to talk a little bit about, get into our Q&A section. Some folks who RSVP'd actually submitted questions for tonight, so we want to thank folks for doing that, and we'll try to get through some of the other questions as well. Let me pull up the questions. Got someone who said, love this idea, bringing the three of the fabulous CEOs together. Thank you so much for holding this debrief. My question is, why can't some of the members of the health committee figure out how to wear a mask correctly? Dale, you want to take this one?
Yeah, I would. I assume you're talking about wearing masks under their noses or worse, under their chins. And I think we should ask those elected officials if they would wear a condom on their testicles and expect it to work. You might want to edit out that response, but that's up to you. That's all I got.
Yeah, and like not being safe, right? Like there's, I mean, quite literally, I think I've seen Representative Stephanie Borowitz not even wear one. Like she literally just like walks in without one. So definitely unprotected, to your point.
Yeah, and as we all know, jokes aside, it's completely selfish. And if you don't care about yourself, do it for your community. So it really underscores the fact that they don't care so much about their communities.
Yeah, it's really unfortunate. You know, it would have been funny, Melissa, if you had worn a mask during your testimony and be like, look, I'm wearing one. It's easy. I'm on camera. I feel like that would have been funny. Thank you, Dale. Let's get to another question here. What information would be helpful when writing a letter to the editor for a local paper? I'm concerned with the latest hearings and Representative Rapp's blatant demonizing of Planned Parenthood and pro-choice. Pop it over to Melissa. You want to answer this one?
I think what's important and what really resonates with people is when you share your personal stories. And so if you want to write a letter to the editor and you have a personal experience as a patient of Planned Parenthood or through a friend or loved one did, I think sharing your experience and the kind of quality and non-judgmental care you received at one of our health centers really goes a long way to the destigmatization and also to letting folks know that, you know, the majority of people who identify as women and, you know, who come to Planned Parenthood do so because they know they can trust us.
Absolutely. Okay, let's see. Looks like we've got another question here. How can we help combat misinformation about crisis pregnancy centers? How should we best advocate for reproductive justice online?
I can address that since I talked about crisis pregnancy centers. I'm happy to address that. I think, you know, being aware of the crisis pregnancy centers in your area and educating those you know about them. They tend to adopt logos that, for instance, there's one at 12th and Locust right across from our headquarters in Philadelphia, and they've adopted the logo of another abortion provider that's just a few blocks away. They use the same font, but there are critical differences. And also calling your legislators too, and ensuring, holding them accountable to stop funding them, entirely. This is, I know science isn't, popular anymore among many, but it's still critically important, and they are, promoting, information that is not evidence-based, as we've talked about before. And it's, so it's pushing back and writing, talking to your legislators, and just educating those, and being aware that they far outnumber legitimate healthcare, sexual and reproductive healthcare providers.
And I would just like to add to that, that you could also contact your local Planned Parenthood and become an advocate. We have lots of information. Sometimes people do come to us with a certain concern. We can help provide you with materials and education. But as Dale said, getting that message out to your networks is so important. And we are always looking for people who are willing to do that can join with us in this movement and effort.
My favorite plug. We've got another question here, and it says, for each of the CEOs, so each of you to answer this individually, if the legislature were friendly to sexual and reproductive health, what bill or policy would you want to see through?
Well, I want to see comprehensive sex education passed. I know that's been introduced. Representative Benham was one of the primary co-sponsors on that bill, and that's vital to our young people being able to live healthy lives and have the information they need to make the best decisions as they grow into adulthood.
Well, if we had a friendly legislature, I would like to see them eliminate all the restrictions on abortion and make it much more accessible, easy to obtain, funded by Medicaid, really an available service to everyone who needs it.
That was what I was going to say, what Kim said. And
that's why I said it so fast, Dale.
I'll just add on that I would, talked about a bill tonight about codifying Roe and making it Pennsylvania law, just to pile on top of that. So
I think that's a good place to end. Wow, we're lucky that some of the advocates do, some of the legislators that are advocates do lean on Planned Parenthood for recommendations, but we're open to talking to Republicans too, and other anti-legislators or any legislator of any party about proactive policies. Folks might learn a thing or two, I think, just by talking about it. So I think we'll wrap that portion. And, again, we wouldn't be Planned Parenthood without, particularly Planned Parenthood Pennsylvania advocates, without some calls to action to close out tonight's event. I think first and foremost, want to encourage folks, call Representative Kathy Rapp, tell her to stop this. I think, you heard us tonight talk about how this is wasting taxpayer time and dollars, and we're in the middle of a pandemic. Tell her to stop this nonsense, to not run these bills, and to stop hosting anti-abortion hearings. Second call to action, want to make sure folks are following us on social media at PPPA advocates on Twitter, on Instagram, on Facebook, and definitely make sure you're signing up for our email list to get alerts about events like these and other organizing efforts throughout the state. And definitely check out our website. And certainly, this is last but not least, share your story, like Melissa said. And if you have a story like Abby's, or have accessed or relied on Planned Parenthood Health Center or sexual and reproductive health care, your story matters, and it's super important, and it deserves attention and to be shared. And thank you so much. Thank you to our fabulous CEOs for coming together. We haven't really done anything like this. So like I said in the beginning, I wish it was under better circumstances, but it definitely shows solidarity for folks who are tuning in. I hope folks found this program informative and helpful, and you can rely on Planned Parenthood. So thank you everyone so much. Thanks everyone.